Bismillahirrahmanirrahim. Now another video. In the video I can see that there is a 9 years old girl in hospital settings, looking ill looking, anxious, apparently well gone. However, I want to do the anthropometry and there is IV cannula monitored in situ, and there is shallow abdominal breathing pattern is present. So it's a case of deep shallow rapid and deep breathing with intercostal recession associated with abdominal breathing, so most likely small breathing. So differential diagnosis: K for ketoacidosis, U for uremia or kidney disease, S for sepsis, M for methaldehyde intake, A for methanol intake, A for aldehyde intake, alcohol intake, L for lactic acidosis, and it may differential diagnosis may be pneumonia also. So if it is a case of diabetic ketoacidosis, what history, onset, course and duration, polyuria, polydipsia, polyphagia, and fever, weight loss, daily activity, and any abdominal pain, any unconsciousness, medication history, medication storage history, who compliance of the insulin, number of hypo attack, number of hyper attack, hemoglobin A1C diary and diabetic diary, and involvement with the multidisciplinary team, regular follow-up happen or not, and impact any manipulation to convert the hypo and hyperglycemia, dietary history, exercise history, impact of this condition, family history of this illness present or not. And if it is a diabetic ketoacidosis, on examination, airway, breathing, circulation, vital sign, level of consciousness, dehydration status according to the pH, and sign of cerebral edema, infection present or not, and respiratory system examination. And then the investigation to establish the diagnosis of diabetic ketoacidosis: blood CBG, and capillary blood gas level, and also urea electrolytes, and then and blood ketone level, and to see the previous diabetic control, hemoglobin A1C, and to see the infection, full blood count, blood culture, urine culture. If sign of meningism, so lumbar puncture, and other baseline investigation, renal function test, liver function test. And if it is a newly diagnosed case of diabetes mellitus, so glutamic acid decarboxylase, islet cell antibody, celiac screening, IgA, and thyroid antibody, thyroid function test. And then management, acute management and long-term management. Acute management: admission, airway, breathing, circulation, give oxygenation. If the GCS is less than 8, so admit under PICU. If more than 8, so HDU. And management: nothing by mouth, fluid, NG tube suction, involve the senior, and fluid management. If the child is shock or not shock, and the dehydration status according to the pH. If the child is shock, such as hypotension, weak and 3D pulse, so the normal saline, and there is severe dehydration, pH is more than less than 7.1, so severe dehydration, and management will be end the shock 20 ml per kg normal saline within 15 minutes. But if it is not a short, mild to moderate dehydration, so the fluid will be 10 ml per kg over 30 minutes, and we have to subtract this fluid from the total fluid, and we will calculate the fluid management by maintenance fluid plus deficit according to mild to moderate if the pH is more than 7.5. So 5% dehydration, 5 to 7 5% dehydration. If the pH is less than 7.1, so 10% dehydration, and we will calculate the fluids over 48 hours, and we will push the fluid over 48 hours, and then after fluid management, when the child is start passing urine, add sodium chloride, and sodium chloride will be added 20 millimole per 500 ml normal saline, and then after 1 to 2 hours insulin actapid infusion by IV, and then monitoring for signs symptoms of cerebral edema, papilloedema, headache, confusion. If it is present, first exclude the hypoglycemia. If there is no hypoglycemia, so mannitol or 2.7% sodium chloride, and then subsequent management, add 5% glucose when blood CBT level is less than 14, and then convert subcutaneous to oral IV infusion glucose to subcutaneous glucose when the child is stable, and then long-term management via the multidisciplinary team, pediatric consultant, diabetologist, endocrinologist, and dietitian support group, and then advice for the feeding, exercise, giving the action plan, and advice and support group. Thank you.